The following presentation is for informational purposes only and is not intended to diagnose, treat, or cure your condition, or to be a substitute for advice from your physician or other healthcare professional. Welcome to Tools for Healing and Well-being. I'm your host, Elaine Jagelski. And in this episode, we're going to explore breathing into wholeness. And what that means is breath is the foundation of life. And without breath, there is no life. Breath or oxygen is involved with every single aspect and every single function within the body. The wonderful thing with this particular practice or discussion is that you already know how to breathe. And so it's just about applying it in a very specific way. And so what we're going to take a look at, and we will do a little practice later on, is what's called heart-brain coherent breathing, or in some cases just coherent breathing. And with that, first of all, looking at what are we making coherent? So the brain is capable of 5 different brainwave frequencies or states, and we're going to take a look at 2 of those. The first is referred to as beta. Most adults spend much of their time in the beta brainwave frequency, and that runs about 13 to 32 or up to 40 hertz. And this is considered to be an aroused state. It is a state that a person spends when they're doing things, they're focused, potentially motivated. And so it's a great state to be in. The issue arises if a person is spending a lot of time in what's referred to as high beta. And high beta is when you're at the upper end of that frequency range. And that is associated with being in a stress state. And so that isn't ideal. Now, normally, if we get stressed, we have a recovery period. And that's just a normal part of our functioning, where something stresses us, the sympathetic nervous system kicks in, we go into that fight-flight response, but then the stressor leaves or decreases, we recover, and all is well with the system. The issue becomes when we are chronically stressed and we're in that high beta frequency range, and then the impact on all of the other systems within the body. And there's lots of information these days in regard to the negative effects of stress on a person's well-being, in all areas of well-being. And so the ideal is to then have times where we're incorporating specific breathing practices like coherent breathing to bring ourselves back down into an alpha brainwave state. And this is about 8 to 13 hertz or so. And this is considered to be a flow state. It's the state of calm, tapping into intuition, even daydreaming. And so by applying breath work in a specific way, we can help work with the frequencies of the brain to move them into more ideal states depending on what is it that we want to accomplish or achieve. And definitely in regard to overall well-being, to spend more time in states like alpha, more of our conscious time in alpha. So when we look at the coherence or the harmonizing of that with the heart for this brain-heart coherent breathing, the heart has an electromagnetic field that can extend anywhere from 3 feet up to 6 or more feet away from the body. It has an amplitude or the ability to conduct electrical energy that is anywhere from 70 to 100 times greater than that of the brain. So it's a very powerful field. And when you combine or harmonize or make coherent those 2 sets of frequencies, then we have a very powerful force for healing within the body. So you might be asking, then how does this, what are the benefits of this amazing force that we can work with more consciously to create health and well-being? And the first benefit is in regard to decreasing stress and tension. And part of this is that kind of diaphragmatic breathing that we're going to be looking at, this coherent breathing, helps to reduce cortisol levels. And so with cortisol levels, it is one of the things that is associated with the sympathetic nervous system, and again, that fight or flight response, that stress response. And so if we can decrease those cortisol levels, then that helps induce more of a state of calm and relaxation. The second benefit, and these are all studied, researched benefits for the body. The second is in regard to heart health. Now, some of the studies that have been done look at regular, either coherent breathing or similar types of practices that involve nice, deep diaphragmatic breathing, and its effect on lowering blood pressure quite significantly. And the other impact on overall heart health is in regard to what's referred to as HRV, or heart rate variability. And it is the amount of time between heartbeats. And so the more time between heartbeats, so the more variation is associated with better health. And diaphragmatic breathing can help produce that. The third benefit is sleep. And it helps with increasing vagal activity, which is associated with our parasympathetic nervous system, which is about relaxing and becoming more calm. And so it helps with overall sleep quality. And the fourth benefit is mental clarity or cognition. Getting in more oxygen can help with improving focus, with memory, and just being able to attend to the daily tasks more efficiently. The fifth benefit is improved mood, and part of this has to do with decreasing the stress and anxiety a person may experience. It also helps produce more GABA, or gamma aminobutyric acid in the brain, and that is associated with being an anti-anxiety element and a calming element. The sixth benefit is losing weight. There's a few studies that show that regular breathing practices can actually help an individual with significant amounts of weight loss, and it also acts as a metabolism booster. The seventh benefit is in regard to the immune system. So even 3 minutes of the breathing practice that we're going to cover can have an impact of up to 6 hours of a beneficial effect on the immune system. And the eighth one that we'll cover for today is pain management. And so breathing in deeply through the nose helps produce what's called more nitric oxide, which can help with relaxing the fascial tissue, which nerves pass through, and can be one of the elements in dealing with pain management. So applying breath work is like working out. So if you're wanting to work the cardiovascular system, you do a certain kind of exercise, and then you have a break, you allow the body to adapt, and then outcomes occur, and so on. So it's not as if you'd want to do cardiovascular activity 24 hours a day. And just with these kinds of breath work, you don't want to do these all of the time. You apply it, and then you allow for those adaptations, and then the outcomes. Now, with breathing, there are some immediate benefits that may be seen. So for example, with the immune system, as was mentioned, just doing a few minutes can have hours of beneficial outcome with just that little bit of time right after it's been applied. With what we're working with for this kind of diaphragmatic breathing is the diaphragm, which is a dome-shaped thin muscle that lies underneath the rib cage and the heart, and the intercostal muscles that run between the rib cage. And so ideal breathing is, so as was mentioned, you don't want to breathe with this deep breath all of the time, but you, as will be demonstrated, but the ideal breath for just in general is to still breathe in through the nose. Unless there's any congestion, then obviously breathe in through your mouth. That's just fine. But if you can, breathing in through the nose, taking it as deep into the lungs as possible, but it's very gentle. Some analogies have been made or sort of examples where if you put a feather on your top lip and then breathe, that feather shouldn't even move, but the air is going deep down into the lungs. So that would kind of be the ideal breath. I'd like to introduce my guest, Renee Scotland, for the practical portion of this episode. Hello, Renee.
Hi, Elaine.
Hi. So if you don't mind just telling us a little bit about yourself.
I retired from a career in public safety, which was very challenging, could be stressful at times. And then after that, I transitioned and taught at the post-secondary level for a while. And then I decided I'm ready for retirement. So I'm retired now and just living large.
Oh, sounds wonderful. All right. So I'm just going to briefly run through the benefits of the heart-brain coherent breathing, and then we can see which ones might apply to you in your current lifestyle the most. So the first one has to do with decreasing stress and tension. The second is improving heart health. The third is improving sleep. The fourth is deals with mental cognition and improving mental clarity. The fifth is a benefit for mood, so uplifting mood. Sixth is in regard to losing weight. And the seventh is about pain reduction. And number 8 is boosting the immune system. So do any of those sort of jump out at you as something that might be useful for you at this time in your life?
I think all of them 1 through 8,
Okay.
really. But 3 jumped out at me more than the others. That would be probably anxiety, relieving anxiety and stress, because you have ups and downs and you have daily challenges which are out of your control and your mind gets busy. And then the second one, I think sleep would be a big one because sleep's at a premium and it's hard to relax and have a good quality sleep. And lastly, weight control, weight reduction. Especially for women when we're postmenopausal, it's so easy to gain weight. So that would be appropriate, I think.
Yeah, absolutely. Oh, right, wonderful. So that's helpful to identify a few of those that would be applicable for you specifically. And before we get into the demonstration part, if you can just sort of do a gauge for yourself as far as we're going to look at sort of the stress tension at this point and just kind of how you feel. So just take note of how do you feel at this point in time. And as far as the stress tension part or stress anxiety part is, if let's say if 1 was really calm, almost asleep, and 10 was almost having a panic attack, just you don't have to say at this point in time, but just kind of take a gauge of, kind of where you at. And it doesn't mean that you have to be super stressed in order for this to have any benefit at this point in time. And then just in general as well, as far as how are you feeling regarding how much energy you have at the moment and those sorts of things. All right, so you've got that gauge for yourself.
I do.
Perfect. All right. Now, let's get into the demonstration portion. And so I'm just going to talk you through this. And we're going to start with that nice diaphragmatic breathing. And so that involves the diaphragm, which is that thin dome-shaped muscle on the bottom of the rib cage, and that sits below the ribs and the heart. And then from there, what you're going to do is you're going to form your hands into C's. So you're just going to take the thumb on the one side and the fingers on the other. And so then you're going to put your hands on the lower end of your rib cage. And as you do that, you're going to do, and so I know because the hands are up on here, there's a tendency for the shoulders to be lifted. So just, yeah, you got it. Let your shoulders be relaxed. Then from there, you're going to do your best just to take as deep of a breath as you can. So allowing the rib cage to expand as much as possible. So just give that a go. Just take a nice deep breath in.
Through my nose or mouth?
Oh, excellent question. In through your nose. So as you practice a few of those nice deep breaths, you want to breathe in through your nose for this particular breathing practice because you produce more of what's called nitric oxide. And nitric oxide helps to relax the fascial tissue, so that's the pain management part of it. And so it has a lot of other benefits in the body as well. So definitely in through the nose, out through the nose if you can. And if for any reason you go to try this breath and there's any sort of congestion, well then you breathe in through your mouth, of course. You just do the best you can. Okay. So what you're feeling for is that there is pressure along the fingers, the webbing, and the thumbs. And so it doesn't have to be equal, but just noticing of, okay, am I expanding deep down to the bottom of my lungs? All right. Then the next little check for that, for the diaphragmatic breathing, is to take your one hand on your abdomen, or like just below the rib cage, and one hand just in the chest area. And once again, you're going to take a couple of those nice deep breaths. And what you're looking for is movement in the bottom hand, and next to no movement, if anything at all, in that top hand. Okay, so you want to make sure that the breath is low and deep, because if there's a lot of movement in the chest, then what that is signifying is that you're in shallow breathing, and shallow breathing is associated with stress. When we're stressed, we tend to do a lot of shallow breathing. And so this is a little gauge. Did you notice the difference as far as the movement? It looked like it was good as far as there seemed to be more movement in the lower part and not as much for that upper hand.
I wasn't really paying attention at first to the lower hand until it was placed there.
Okay.
But then I focused more on the lower part moving when I was breathing.
Excellent. All right, fantastic. Now, for the next part, I'm just going to talk you through. And so if you feel comfortable, feel free to close your eyes. And that cuts out about 85% of the external stimuli that is there. And before we get to that, we're just going to start this off with what are called physiological sighs. And so this is a quickie. If a person's looking for sort of a quick relaxation, mental clarity, reset, then this is something they might want to do, or even before bed, or if a person doesn't have a lot of time. So I'll demonstrate the physiological sigh, and then you'll do that. So all you're doing is breathing in through your nose, and then you're going to take a sip, and then out on a sigh. So give that a go. So fill in as deep as you can. Then even when it feels like it's full, you take an extra sip of breath, and then out on the sigh. So we're stimulating what's called the vagal nerve. And one more of those. Deep. Perfect. All right. Now, again, feel free to close your eyes, and I'm going to talk you through the rest of it. Just as a note, this can be done with the eyes open. If a person's in a meeting, they're driving, they're in a conversation where closing the eyes isn't available, then keeping the eyes open can work as well. But closing the eyes, as was mentioned, cuts out about 85% of the external stimuli and really takes you into yourself. Good. So now what you're going to do is you're going to go into that deep breathing. So deep, deep breath, expanding into the bottom of the rib cage. And even though technically you're breathing in through your nose and out through your nose, you're going to imagine, envision, intend that you're actually breathing in through your heart and out through your heart. And we're going to add a count to the breath, approximately 5 seconds in and 5 seconds out. So if you get ready for an inhalation, it's something like breathe in, 2, 3, 4, 5, and out, 2, 3, 4, 5, and in, 2, 3, 4, 5, and out, 2, 3, 4, 5, and in. So just keep that rhythm going just as best as you can. If it felt a little bit too fast, slow it down. If it felt a little bit too slow, just speed it up slightly. And then you're going to do your best to focus, breathe in and out one or a combination of the following words: care, compassion, gratitude, appreciation. And there's no right or wrong as far as how you do this. So just breathe in one or a combination of those words. And then if the feeling is there, if you can conjure up the feeling associated with any one of those words, then breathe in the feeling associated with care, compassion, gratitude, appreciation, or anything similar, kindness, love, whatever works for you. Now, it's normal for the mind to wander, so kind of like a border collie, just keep herding your focus back to something in the present moment. So incorporating that mindful aspect where you're here now, and that might be the sensation of the breath, the count of the breath, the word, the feeling of one of those words. So just continuing to bring that focus back to here now as best as you can. Wonderful. All right. And then just letting it go, and then just bringing yourself back to here now, opening your eyes whenever you feel comfortable to do so. All right. Well, that looked like you did a fantastic job with that. And so how are you feeling now?
I feel very relaxed, actually.
Okay. So if we look at that scale of, as at the beginning, where 1 is you're almost falling asleep and 10 you're having a panic attack, relative to where you were when you first kind of checked in, and energy levels and all of those sorts of things, where are you now?
About a 2.5, as opposed to the start where I was at a 4.
Okay, all right. And so what are you noticing as far as any other differences?
Well, when I had to focus on the word, I chose the word gratitude this time. And I thought about things that I have in my life that bring me gratitude. So I was doing the breathing all throughout that and thinking of very positive things, which distracted me from the things that were causing me to be nervous. So that helped me relax. And then the counting, I kept going in my head. I found that really helpful too.
Great. All right. And how was it to stay in the moment? Did you find that you did need to keep refocusing? Because that tends to be fairly normal for a lot of people to have to kind of keep coming back to the moment and quieting the mind.
Yeah, well, when you're worried about stuff and there's all kinds of life distractions causing you stress, it's hard to come back into that moment and eliminate those distractions. But when you asked me to close my eyes, that helped.
Great. Okay.
And so that allowed me to kind of focus on the inside and what I needed to do to relax.
Wonderful. Now, is this something you think you'd be able to apply when you've got that busy mind before bed, for example, because you had mentioned that sleep is potentially an issue at times. So is this something you think you'd be able to do to help quiet your mind and then move into a more relaxed state to more easily fall asleep?
I think so. I feel very relaxed right now, and I'd like to try it at bedtime on a night where I'm having trouble sleeping to see how it works. But what might help me as well is changing the setting momentarily, going and sitting in a more comfortable chair, relaxing, doing some breathing, and then going back to bed and try to get some sleep.
Great idea. And so in regard to the stress and anxiety, sometimes in the moment, if this hasn't been practiced a lot, once you practice it more so, it just becomes something that you don't even have to think about as much. And even if when there's some stress, anxiety, or even the pre-sleep, or just in general, whatever aspects of this you can remember, even if it's just those physiological sighs, Or even if it's just, I'm going to breathe in for about 5 seconds and out for about 5 seconds, or I'm going to think about these words, or I'm going to try to feel these words. So not to be too concerned if, I don't have every aspect of every step right off the bat. It's just even getting that nice deep breath in, that diaphragmatic breathing in through the nose, out through the nose, unless, as was said, there's some congestion or anything along those lines, then breathe through the mouth. That's fine. And so any closing words as far as this whole process for you today?
Well, I think I'm open to trying it. I think it will help with reducing stress, and it's free. It's everybody breathes, it comes naturally, but I don't appreciate the nuances of breathing. So thank you very much.
You're most welcome, and thank you so much for being willing to demonstrate this practical portion of this episode. As was demonstrated, you can see that this practice is fairly easy to apply. And as was mentioned during the demonstration, it's okay if you don't remember every single element of how to do it. The key aspects of this are taking as deep a breath as possible, keeping it rhythmic, and possibly thinking of one or a combination of the words that had been mentioned, the care, compassion, gratitude, appreciation, or feeling good, feeling something good, and just breathing that in and out. Even those basics will serve you well. And as has been mentioned, breathing in through the nose, out through the nose, if that is available. And so whether you're looking at decreasing stress and tension, improving your heart health, improving your sleep quality, improving mental clarity and cognition, having a better memory, being able to attend to those daily tasks more effectively and efficiently, improving your mood, which can also be related to actually lightening depression. So if it isn't too serious, using this kind of breath work can help alleviate some of the symptoms of that to some extent. Losing weight. So both in the short term as a metabolism booster and in the longer run as far as overall weight loss and maintenance. And then helping the immune system. So boosting that, and as has been previously mentioned, even a few minutes can make a difference. So there are very, very immediate and short-term benefits associated with this type of breathing or similar breathing practices. And there are also longer-term benefits by doing this over time, as often as one can. And with any other change in lifestyle practice, to know that it's okay, do what you can to begin with. This doesn't have to be all or nothing. As far as, I have to do this every day, and if I don't, then that's going to be an issue. Not at all. Incorporating this whenever you can recall is a wonderful thing to do. And the wonderful thing about breath work is you don't need any equipment. It doesn't cost you any money. You can do it anytime, anywhere, to help improve your own health and well-being.